And the fear was not for myself. My fear and concern was for my family. My wife has medical issues that put her at a higher risk, as does my 2-year-old. That's when we decided that there would be no more physical contact at all and that they needed to move out of the house. When I saw my wife from the window upstairs drive up with all of their belongings in the trunk, it broke my heart. My symptoms were getting worse, and I did not know if I would ever hold them again.
Did you believe that the COVID-19 survivors is now fighting against patient loneliness? Unfortunately, they are. Pain, loneliness, and fear has been going throughout their life, even after the virus is no longer in the body. This outcome have persuaded me to realize that the COVID-19 survivors should be isolated from the community. There are 3 reasons why COVID-19 survivors should be isolated. First and foremost, they're having physiological issues. Second, they're avoiding social stigma. Last but not least, they are dealing with the patient's immune systems. Now that you are aware of the overview, let's begin my speech with the first point. Having patients' physiological issues can lead to mental disorders. Patients with disease infections have more physiological issues than other patients during outbreaks, and they may suffer from varying degrees of stress disorders even after treatment and discharge. They developed various mental health conditions within 6 months of recovery. Studies on SARS indicated persistent mental disorders such as post-traumatic stress disorders (PTSD) in 40% of survivors even after 3 years. Next, physiological issues can lead to neurological disorders. In the first 3 months after infections, COVID-19 survivors have an increased risk of mood and anxiety according to a previous retrospective study. They need to stay away from other people to avoid long-term complications. A good example is seizures that can affect cognitive or emotional symptoms such as fear and anxiety. Moreover, physiological issues can lead to long COVID. Long COVID is a term that describes the effect of the virus in an individual who is no longer has the infection. The most concerned about this situation is that people experience lingering health problems even when they have recovered from the acute phase of the illness. For example is fatigue, exhaustion, and the inability to do physical activities. This highlights the needs for COVID-19 survivors to have their own time and space from community. As we already know that COVID-19 survivors dealing with physiological issues is one of the reasons they should be isolated. Now, I am going to explain how social stigma affect COVID-19 survivors. Social stigma that COVID-19 survivors faced is social exclusion. They sometimes felt more excluded in both physical and virtual places closer to their everyday life. Reason is that community fear that its survivors are still contagious. This can be seen by physical distance between survivors and their colleagues were slightly greater than before. Furthermore, discrimination issues also one of the social stigma that should be avoided. It can be seen from the trauma of COVID-19 survivors largely result from the negative social interactions. As a result, they experience the feeling of shame, guilt, and worthlessness. Consider the example of they receive a great deal of neglecting calls and messages from friends, employers, colleagues, and neighbors. In addition, community perception occur from this social stigma. There's a misconception about COVID-19 survivors, which is community really think that COVID-19 survivors bring negative impact to them. According to that, the fear of dealing with recovered patients and lack of communication and knowledge surround the community. For instance, the perception of COVID-19 survivors still have the disease and not fully recovered yet. This shows the seriousness for the COVID-19 survivors to quarantine themselves. It is unacceptable that social stigma also one of the reasons COVID-19 survivors should separate themselves from others. Next, let's look at the final reasons COVID-19 survivors should be isolated. COVID-19 survivors are dealing with patients' immune systems. They are still unsure with the duration of acquired immunity. This is the unsolved question of current coronavirus disease. The fact that recovery from an infection confers an almost magical ability to fight off the same pathogen in the future. As such, HCOV stands for human coronavirus. Next, they need to fight reinfection. In the following months of infection, there was a significant reduction in COVID fighting antibodies. Some worry that body will not be able to protect itself against reinfection because of the drop in antibodies. It is found that body will not be equipped to defend itself against reinfection. To illustrate, memory B cells could reactivate and produce SARS-CoV-2 antibodies to fight reinfection. Besides, they deal with immune memory. A researcher cautions that protective immunity does vary dramatically from person to person. There are people who are at the very bottom of their immune memory and who may be vulnerable to reinfection. As an example, people with weak immune memory may be vulnerable to a case of recurrent COVID-19. Patients' immune systems is truly one of the reasons COVID-19 survivors should segregate themselves. I have briefly explained all of the points to you, and I hope that people can understand the importance for COVID-19 survivors to be isolated. Now you know that there are 3 reasons why COVID-19 survivors should be isolated. Firstly, they are dealing with physiological problems. Secondly, they're attempting to escape social stigma. Thirdly, they're suffering with immune systems. To conclude, Oscar Wilde once said, "What seems to us as bitter trials are often blessings in disguise." Put in mind that we are not living in fear, we are living with faith. I just hope we can slow the spread of COVID-19. And please stay home if you can. Thank you.